Growth factors, exosomes, peptides. Words that sound straight out of science fiction are actually shaping the future of skin and regenerative medicine today. In this episode, I explain what these buzzed-about therapies really are, what's hype versus what's evidence, and how they're used to heal, rejuvenate, and restore. Join us today. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. So, growth factors, peptides, and now exosomes. The growth factors have been around in skincare for a while. Peptides, somewhat new to the market, but really have gotten big. And then the really new kid on the block is exosomes. So today, I thought I'd just talk a little bit about what these things are and why we recommend it. So probably about 25 years ago, I actually was doing some research on putting growth factors in skincare creams to help the skin heal and rejuvenate and respond. Okay, why? Well, because it was thought that these growth factors help your skin renew itself. And when you have sun damage and wrinkles and aging, the thinking is the renewing process will make you look better, certainly help you recover from a procedure, and help you respond, help your skin respond. And so these growth factors are isolated, say, from foreskin, the little cells grown in culture. It's taken from the cell culture that they live in, but they can come from other areas as well, and other types of tissue. They've long been in topical skincare products, and if you come for a consultation and we're talking about doing a series of laser treatments, we will put these in the skincare plan for you to help you respond. So the next cousin to come along is peptides. Peptides are they're little small signaling proteins, and they signal your cell to do an action. Okay, so we talk about collagen. Collagen is a big, giant protein, like huge. So you can't put collagen in a jar, in a cream, and put it on your skin and expect it to get down in your skin. It's too big. It won't penetrate. Some people are drinking collagen, and that's controversial. There may be some evidence that that's helpful. But peptides are small, so you can put them in a cream, a gel, a serum, and they'll get in the skin and have an action. They signal an action. So they might signal for a fibroblast to make collagen. They might signal for some cleansing cells to clean up bad, degenerated collagen and get rid of it before we do a laser treatment. There's peptides that signal at the neuromuscular junction not to release acetylcholine to make that muscle junction work, so it relaxes lines of muscle movement, say around the eye or in the forehead or the lip, like the new SkinCeuticals Ptiox has a peptide like that. So they just simply signal renewal or relaxation of muscle, or maybe reduction of redness, reduction of pigment. They are used for a specific purpose. Now comes exosomes. And today we're talking about exosomes applied to the skin in a topical product. Injectable exosomes are not approved by the FDA, and that's not what we're talking about here. They are even smaller than peptides. So they used to be thought of kind of like cellular trash, right? They're these little tiny nano-sized vesicles. They're just loaded with signaling factors. So they were thought to be excreted by a cell as like a byproduct, but it turns out they're very important for signaling. And inside their little sphere, and inside is a whole bunch of stuff. We'll call them like a whole bunch of packages. I'm going to a wedding at the end of the month, family wedding. So if you go to the registry on the knot, you can get the bride and groom a gift. And so the bride and groom are getting gifts delivered for them to put in their new house, to build a new home, create a new home. These exosomes are loaded with these packages, but the job for them is not building a new home, it's repairing, or maybe it's repairing your damaged knee. It's repairing an injury in the skin. It kind of depends on the tissue and the action. Maybe it's signaling to grow hair because your hair is thinning. One of the controversial things about the exosomes is where it comes from, right? Did their exosome come from fat? Did it come from a plant? Did it come from umbilical cord or blood, a blood bank? And does the tissue of origin matter in its action? I can't tell you that. No one can tell you that now. There's a lot of research going on, and we'll know more. At Charlotte Skin and Laser, we are currently using an exosome that comes from platelets, from a platelet bank. So these are derived from human tissue. They are highly purified, but that's where they come from. This is why the FDA will not approve injections. They do not come from you, okay? And this might get confusing. There's platelet-rich plasma, PRP, that is from your own blood and can be injected to stimulate hair growth or be put on your skin after a laser treatment for healing. But all of this is regenerative medicine. So right now we can harness the exosome in skincare products to help you heal from a laser treatment, to help you get better looking skin without a laser treatment, to maintain the results of a laser treatment. But we are just using it in a topical skincare product. And it's just simply a little micro package of thousands of signaling proteins, signal healing, signal growth, signal renewal, regenerative medicine. And that's what exosomes are. The one that we have here, we see great results with rosacea. Maybe that is because it comes from platelets. I don't know. But if you think about when you cut yourself in the kitchen, the first cell to that wound is a platelet. And it's going to be responding to the wound and promoting healing. And that's the idea behind these exosomes. So with the exosomes, there's a lot more knowledge coming down the pipe. I think this is the future of regenerative medicine. Maybe in the future we can inject it for hair loss, or we can inject it in the skin. Right now we can only use it after laser treatments in a skincare product. And there's more exosomes coming very shortly. Looking at a new one, several new ones right now. So this is like the wild, wild west. This is brand new. One day we'll look back at this podcast and go, gosh, we just know so much more now. We're also learning that some of the growth factor creams that we were using over the last 25 years, turns out they have exosomes in them as well. We just maybe didn't think they were that important. But because they came from cells, the exosomes are there. So we can harness the power of skincare by using growth factors, peptides, and exosomes to renew skin and maybe even help you with hair loss, help you heal from a laser treatment, help you maintain the results from the laser treatment. And we may recommend more than one. We may recommend several peptides because there are many peptides that have different functions in the skin. I use several myself. In regards to products out there, things you can buy online, exosome products, I would rely on the advice of your physician who hopefully has researched the product and knows about the product. In the peptides, patients come in with products that they've gotten offline with peptides in them. And I can see in the ingredients, I know it's a peptide. I just don't know how much of that peptide is in there or how effective it is. I think those products are probably fine, but I think your best bet is using a professional to guide your professional science-driven skincare. So you pick a product that's great for you. And just in the last few months, we've added 2 new peptides, both from SkinCeuticals. One is the PTOX, which is used to relax little fine lines of muscle movement. It's become insanely popular. You use it during the day because that's when you want it to relax. That's its effect, and we do teach that. So our skin store is based on science and teaching you how to use your skincare. And the other one is their RGN6, which has peptides designed to help you recover from a laser treatment, but also when you're not having a laser treatment, to help mimic the results you're getting from a laser treatment. So when you get a laser treatment, it stimulates a whole cascade of responses in your skin. And those responses help your skin renew, regenerate, and create new collagen and elastin. This is a product you take home. Here's one for your bathroom counter. Here's your laser in a bottle is the idea behind that. None of these replace your basic anti-aging skincare, which is antioxidant, retinol, and sunblock, but they are added to that regimen depending on your goals. We certainly recommend them if you're having a laser treatment. We'll recommend specific peptides, say, to help you heal, peptides to help prep your skin for the laser, peptides for healing, and peptides for maintaining. And including in young individuals as well. They want to get the most out of their laser as they possibly can. So some final thoughts on our brief overview of growth factors, peptides, and exosomes. What excites me most, and in my consultations, I've been talking about, this is renewal. We are doing renewal regenerative medicine. We've known it for a while. When we do a laser treatment, we're stimulating renewal. I'm very excited about the potential of these products. Number one, to help you in that process, help you recover, help you heal, stimulate the renewal. But also number two, to help your skin maintain at home. I think the future is renewal, regeneration. And I like it. It's natural. Everybody wants natural. This is natural. It is stimulating your skin to renew. It's about as natural as you can get. So I think when I see patients in consultation, I tell them the future's bright. We are finding out new things daily about the renewal process in the skin, how to harness the power of these exosomes, peptides, and growth factors to help you maintain youthful skin for a lifetime. Thank you very much for listening today. If you've been thinking about adding one of these regenerative products to your skincare routine, a growth factor, a peptide, or an exosome, please visit our skin store. Our estheticians and our laser staff can help you pick a great product just for you and your goals.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.